Hi, I'm Garvin. This telecast is on Fematab. So what is Fematab used for? It's used for hormone replacement therapy to relieve symptoms of the menopause and a second line treatment option for preventing osteoporosis in postmenopausal women who are at high risk of fractures and cannot take other medicines licensed for preventing osteoporosis. So Fematab 2 mg tablets only for this. So how does it work? Fematab tablets contain the active ingredient Estradiol valerate, which is a naturally occurring form of the main female sex hormone estrogen. Women's ovaries gradually produce less and less estrogen in the period up to the menopause, and estrogen blood levels decline as a result. The declining levels of estrogen can cause distressing symptoms such as irregular periods, hot flushes, night sweats, mood swings, and vaginal dryness or itching. Estrogen in this form, in this case in estradiol valerate, can be given as a supplement to replace the falling levels in the body and help restore these distressing symptoms of menopause. This is known as hormone replacement therapy, or HRT. HRT is usually only required for short-term relief of menopausal symptoms, and its use should be reviewed at least once a year with your GP. Fematab tablets are a continuous estrogen-only form of HRT, as they contain only estrogen. They are most suitable for women who have had a hysterectomy. Women who have not had a hysterectomy should also be prescribed a progestogen medicine to take with this medicine for the last 12 days of each 28-day pack. This is because estrogen stimulates the growth of the womb lining, or endometrium, which can lead to endometrial cancer if the growth is unopposed. A progestogen is given to oppose estrogen's effect on the womb lining and reduce the risk of cancer, though it does not eliminate this risk entirely. This is known as combined HRT. If a woman has had her womb surgically removed, such as a hysterectomy, endometrial cancer is not a risk, and a progestogen is not necessary as part of HRT unless the woman has a history of endometriosis. HRT is also sometimes used to prevent osteoporosis in postmenopausal women. The declining level of estrogen at menopause can affect the bones, causing them to become thinner and more prone to breaking. Estrogen supplements help prevent bone loss and fractures that may occur in women in the years after menopause. Women considered to be at risk of developing fractures following the menopause include those who have had an early menopause, those with a family history of osteoporosis, and those who have had recent prolonged corticosteroid therapy, for example prednisolone, and those with a small thin frame and smokers. So use with caution in close family history of breast cancer, either mother, sister or grandmother has had the disease, a history of benign breast lumps, fibrocystic breast disease, a history of fibroids in the womb, a history of endometriosis, history of overgrowth of the lining of the womb, endometrial hyperplasia, personal or family history of blood clots in the veins, venous thromboembolism, or for example deep vein thrombosis, and blood disorders that increase the risk of blood clots in the veins, for example antiphospholipid syndrome, and women taking medicines to prevent blood clots, anticoagulants such as warfarin, long-term inflammation of skin and some internal organs, systemic lupus erythematosus, and personal or family history of recurrent miscarriage, severe obesity, varicose veins, smokers, history of high blood pressure, and raised levels of fats called triglycerides in the blood, history of liver disease, such as liver cancer, and decreased kidney function, heart failure, and a history of diabetes, history of gallstones, history of migraines or severe headaches, and a history of epilepsy, history of asthma, history of ear disorder that may cause hearing loss. So this medicine should not be used if you're allergic to any one of its ingredients. Please inform your doctor or pharmacist if you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using this medicine and inform your doctor or pharmacist immediately. So for pregnancy and breastfeeding, this medicine should not be used by women who are pregnant or breastfeeding. You should stop taking this medicine and consult your doctor immediately if you get pregnant during treatment. A woman is considered fertile for 2 years after her last menstrual period if she is under 50, or for 1 year if she's over 50. HRT does not provide contraception for women who fall within this group. If you could get pregnant while taking this HRT, you should use non-hormonal method of contraception, such as condoms. So again, seek medical advice from your doctor for more. Now, the side effects would be breakthrough bleeding and spotting, breast pain, tenderness or enlargement, headache and migraine, gut disturbances such as nausea, abdominal pain, bloating, flatulence, indigestion, leg cramps, fatigue, weight changes, vaginal thrush, depression, anxiety, dizziness, changes in sex drive, rise in blood pressure, gallbladder disease, swelling of the ankles due to fluid retention, which is peripheral edema, skin reactions such as rash and itch. And the side effects I've just mentioned does not include all the side effects reported by the drug's manufacturer. So for more information about any other possible risk associated with this medicine, please read the information leaflet provided with the medicine or talk to your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicines while taking this one, to ensure that the combination is safe. The following medicines may potentially reduce the blood levels and effect of this medicine, which could result in recurrence of symptoms or irregular bleeding. So anti-epileptic medicines such as carbamazepine, phenytoin and phenobarbital and primidone. The barbiturates such as amobarbital, protease inhibitors for HIV infections such as ritonavir and nelvinavar, rifamycin with an antibiotics such as rifabutin and rifampicin, the herbal remedy St. John's wort, and estrogens may increase the blood level of robinurol used to treat Parkinson's disease. Some women with diabetes may need small adjustments in their dose of insulin or anti-diabetic tablets while taking this medicine. You should monitor your blood sugar and seek advice from your doctor or pharmacist if blood sugar control seems to be altered after starting this medicine. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.